Today's program engaged students, staff, and faculty representatives from 7 health science schools of this university. It is a demonstration of our united commitment toward advancing health equity.
Looking over the past 100 years of periodontal medicine, you can see that Dr. Taylor's work with colleagues here at the University of Michigan was cited as significant as it related to the significance of diabetes and the relationship of oral health. So we're so thankful for having a scholar and resident with us today who will share his passion not only for his work and research, his life story we've asked him to share, as well as to share his passion for health equity.
Things are a lot different when you could see what we saw last night and these young folk who are forging the future and the history of health science and challenging some of the inequities that have been in existence for a long time.
Misery loves company, but so does success. And I like to be around people that kind of look like me. Just think about the things that he had to deal with. Evolution, revolution, from segregation to elevation. Think about how he had to raise himself up.
When you talk about elevation, segregation and elevation, we're thinking, it makes me to think, reflect on my career and my actions in addressing health disparities. Humble, not nearly enough, and yet recognizing that we all can play a part in addressing health disparities. An important evolutionary milestone in my life's journey while at UVA was my leadership in working with other Black schoolmates to create an organization. We called ourselves the Black Students for Freedom. We declared it, and the organization existed. We learned that. Some of that we learned from church, actually, that we declared it. And then from that time on, the Cavalier Daily, which was the student-run newspaper, would check with us. Well, what do the Black students have to say about this? Well, we had some things to say. And one of them was the absence of, or the relatively small number of Black students who were being accepted and who matriculated. We worked with the administration, that's a euphemism, to be able to travel, to be able to recruit Black students, to bring Black students into the school, into the university. We saw that as an inequity, if you will, not knowing about, not university, not recruiting, not instrumenting or instructing public schools that they, Black public schools, I'm going to say, yeah, that was my world, that the university exists and that we would be welcome. The evolution there for me was that longstanding inequities could be addressed. It took willpower, it took courage, as we've heard, and it also took an awareness that there's a need. And in many cases, if we can't do it, who's going to do it? If we recognize it, then I would say, in terms of inequities, it's a moral responsibility to address it.